Well, welcome. Best practices for sustainability. We're happy you are here. And let's get started. We are part of Public Health Institute, and we will share our slides when we are done with this. You will receive a post-event email. Again, make sure that your chat questions are addressed to everyone so everybody can see, because remember, if you're asking it, there's probably a lot of others that want to know the same thing. All right, so as we start with all of our Navigator focus, we always want to remind our goal at California Bridge is to access high quality treatment of substance use disorders in California by all California hospitals 2025. So not far away, we're currently at 270 plus, so we're making really good progress. Our California Bridge model, just for review, you guys know this stuff, but we always have a few newcomers. So just to remind everybody, our bridge model is three-pronged. We're revolutionizing the system of care with low barrier treatment. That's what our doctors and the ones that are here today do. They push low barrier treatment and are giving buprenorphine in the emergency room. And then the two last pillars, connection to care and a culture of harm reduction, those are what you guys are doing out there. And we know it's a struggle. We see you. So we are so appreciative of the work that you're doing out there. You are such a key and vital part of this program. So we have some announcements. Our next Navigator focus series will be navigating and engaging community resources. And we have our own resource here. Our PA, Josh Lufting from Highland, will be talking about harm reduction, and he will be going over the naloxone distribution program. So please make sure December 14th that you meet us here again. These are our objectives for today. So you will learn all about sustainability and for sure 2 strategies from our today. I am going to introduce my executive director. She runs all of this program and this chaos here with all of us. She's my boss, and she's going to give us some opening remarks about sustainability. Serena?
Great. Thank you, Sherrie. I'm super excited to be here. I have to say, I don't come to these Navigator focus series very often. So it's really a pleasure to be here. And it's so fun to see all the names popping up in the chat. I am here because as soon as you say the word sustainability, that's when my brain kicks in and I'm going to be there. So we've done a lot of thinking and a lot of work about sustainability. And can you go to the next slide? I'm hoping that some of this is going to sound very familiar to you because we've been talking about it for a long time, but it's easy to talk about, but harder to do. So I just want to go through the 3 main steps that we've been advocating for sustainability. The first one is the one we've spent most of the time on. We've had practice sessions, we've had webinars, we've done it in person, and that's what we're calling Build Your Fan Club in the Hospital. And essentially what we're talking about there is get the word out about what you do. Tell your stories about your work, make sure people know who you are, tell your patient stories or success stories, use your data. We have our site summaries that everyone gets. We have our ROI calculator. So I hope you are very bored of hearing us talk about that because we are trying to talk about it a lot. And I want to say that is still probably the most important thing for you to do because most of the sites that have sustained their navigators have sustained them through essentially that strategy. There wasn't any magic revenue that came floating down. It was basically they just got out there and they told the folks in their hospital, like, what we do is really important. And they got someone to listen and buy into it and say, yes, we're going to keep that position. So strategy number 1 is still super important. However, today, what we're now going to talk about is strategy number 2 and 3. So strategy number 2 is maximize revenue. And there has been now for several years the MAT procedure code, which is a clinical code that physicians use that doesn't relate as much to the work of navigators, but what we're going to talk about today is community health worker billing. And that's what Reb is going to talk about. And then we're going to talk about the 3rd strategy, which we called Make Friends in the Community. And we sort of identified 2 primary entities that could be helpful to you as friends: the county, because the county runs the substance use treatment system and controls a lot of dollars, including opioid settlement funds, and also health plans. Health plans control resources. So we are going to hear from Erica later about her work with her county health plan. So that's my overview of what's happening today. And I am now going to introduce Dr. Reb Close. So I asked Reb to send me her titles so that I could get them right. And she sent me her titles and I said, Reb, I don't have all day. She has so many titles. She does a lot. And Reb is one of the people that we have worked with very closely from the beginning. She's an addiction medicine and emergency medicine physician at Community Hospital of the Monterey Peninsula, we call CHOMP. She's also an attending addiction medicine physician at the Pacific Rehabilitation and Pain. She leads the Central Coast Overdose Prevention Coalition, I think that is. She's an implementation leader for us, and she's the medical director for the Montage Health Prescribe Safe project. If there is a thing to try to help save lives and to help people get access to treatment, Reb will try it. And so she is probably the first, her hospital is the first hospital that has successfully billed for community health worker services. So that's what she's going to talk about. And the last comment I want to make about that is that not everyone else is going to immediately be able to take what Reb shares and apply it to their hospital. There are a lot of structural barriers around what your health plan will allow, what your hospital will allow, what kind of contract your hospital has with the medical health plan that can make it challenging to implement this. But it's helpful for you to listen to what Reb is talking about and kind of file it away in the back of your mind, even if it's not feasible today for you, because the state is working on policy changes that will make it more feasible for hospitals to bill for this benefit. So even though it might not be feasible for you today, it should be at some point in the future. So we're excited to have Reb here to share her experience like pioneering this billing process. And with that, I'm going to turn it over to Reb.
All right. Well, thank you. And I really appreciate the opportunity to chat with you guys about this. And very much to Serena's point is we'll try anything. And the cool thing is, you know, my hospital, it's a community hospital. It's not part of a greater system. It's basically just us. And so we can in many ways be more nimble or flexible than other programs can be or other hospitals. And we really use that to our advantage. So if you'll pop to the next slide, the community health worker benefit is really having the services that are already being provided paid for by, you know, the insurance company, by the payer, by Medi-Cal. So we looked into this, and it's really, you know, we put all these steps together of how it was done, and there is the guideline that's on the website, so you can go through each of them. It has all the links, but really it was figuring out who could answer the questions that we needed in each step of this. Some of these items are basically stealable, so to speak. You know, our note template, there is no reason to recreate it if you're in Epic or if you're in a similar EHR that can just use it. But really, we started figuring out this billing by just reviewing the Medi-Cal guidelines, really understanding them and learning them and seeing how that fit with the work that was already being done. Those guidelines are attached in the site example that we have. And so on the Bridge site, you should be able just to pull those up and share them with your team. Okay, and then the note template, we also built that to those guidelines. Our shop uses Epic, and so if you're in an Epic system, it should be basically cut and pastable. And if not, then you can put it into whatever template you need for your hospital system. And that's as well available on the Bridge site. The link is there and all the information is available. So we had to figure out what to do and then make something to match that met all the requirements so we could move forward with billing for the service. Then it got into asking people for help, which I'm actually really good at. I have no problem reaching out and asking people to dive into this work with me. And so reaching out to our IT analyst, and I put in the guidelines that we put together kind of the title, literally I just cut it out of their signature lines, the title of who I spoke with that was able to help us move this forward. So the IT analyst, that was the person that built the note type for my substance use navigator to use in our EHR. So if you can just take that for your each individual site and kind of plug those, you know, people into those spaces so you know what you're looking for. So that's how we did it. once we were able to build that note type, then we had to talk to our charge master, and that was the title we pulled out. The charge master actually had to create the charge for this benefit. So it literally was to this level of building, and figuring out how to build this charge into the system. So it was our charge master that did that. And we put, again, in the guide, we put in the example charges, and even the amount that we bill for it, we put that right in there. And ours was the charge master coordinator. There's also the director of billing services, the revenue integrity and financial services. We put all those titles in there because that might be the person at your facility. Okay, so we had to create the charge, and we have the code there for that. Then, I mean, this is so funny, but this is how it all was built and how it came together, is we had to figure out how to get the analysts able to link the note they had made to the charge that was made. But we were able to do that. And so we were able to get those put together, and then they had to go through certain modifiers to figure out how the service was going to be billed and paid. So that was another kind of level to this. And then our finance team, and the title for that was our patient billing services project manager. They had to confirm it was a billable charge. And then as well, we had to put in a null charge for those patients who don't have Medi-Cal. So obviously we're not going to start billing patients that were outside of the Medi-Cal system, because they would be on the hook for these charges. And we didn't feel that that was an appropriate way to do this as we were building. And so then if they are not eligible for the payment for the service, then it just goes to a null charge. So the patient doesn't see any of this at all. And so that was, and I just left it on one slide like this. I mean, it was very nuts and bolts. We do have it in our CHW benefit billing information. So you guys can pull it up and look at it at any time and kind of go through it point by point. What I would like to do, however, is show you my screen. And the reason this isn't in the slide deck is because I just pulled it up. But I'm going to give you, oh, please may I share the screen? And I should have asked earlier, but I didn't. Cool, thanks. So here's what happened with that. Are you seeing my little graph? Yes, no? Yes, okay, I see heads. That's what happened. So as you can see, as we're cruising along, we're building this in March, we're kind of trying to figure it out. And some of the services are going through and some are not. And then in May, we figured it out. And by June, we had changed our revenue from maybe about $1,000 for some of these that were going through smattering here and there to up in the $5,000 zone. So that's how it worked. And that's kind of the bottom line. So I'll keep it short and sweet because obviously we have a lot of good information to share, but I wanted to make sure that I kind of gave you the outline. We have the list of the people that you reach out to at your respective institutions to do that. And then most importantly, the outcome that we saw from doing this work. Ta-da! That's kind of
Wow.
what I'm calling it.
Reb, thank you and congratulations on doing this. You talk so easy, but we know that this was a long labor of love.
Yeah, I didn't go back to when we started, right? No, but that's why we did it. We made it as a template. We pulled the titles out of everybody we talked to. Nobody else needs to create this wheel. The wheel's created. So now just push it, in my opinion.
Absolutely. And who was vital in your leadership? I know there's a lot of chat saying that I'm just a son. Well, you are more than just a son, but for this sake of argument, who should be included, Reb, for our navigators? Who would be crucial to send this video for them to hear the message and how you did this?
Totally. So our ED nursing director, she was key to this. She could definitely see the value of the son work because she's an ER nurse. Like she totally gets this. And so she saw the value to the son work. She's the director for our sons. And she also has the ear of administration, and she was really central to this. Our ER medical director was also involved, but to a much lesser degree. So it was someone in my opinion, and for my site, it was the ED leadership and the nursing leadership specifically, because she was so directly involved with the sons and the patients and the outcomes. So she just kind of got it. And then, your clinical champion, which is the role that I have at my shop, obviously kind of, having the ins and connecting to the right people with her. So those were I think the two main people to be involved from the front line, because they can figure out who to pull in otherwise.
Great. Thank you. Thank you for guiding them. Do you guys have any questions for Reb? Again, we are recording this webinar and you will receive it in the post-event email and you will be able to share it with your team. So a good person, as Reb said, to send it to is your nursing director of the emergency room. So there's a hint right there and a strategy for getting this message out. Now, do you charge for quite all patients or just Medi-Cal?
We drop the charge for everyone, but it nulls out if they don't have the coverage. So if it would and that's just what we chose to do on our side. I don't think that has to be done, but for us, that was how we were doing it. And so we null out anything. So there is absolutely no patient billing for this. That's my understanding.
Okay, great. I am so excited you're here and that it's successful and that our navigators are hearing that there is lots of hope. And Reb, that's what you provided today. And thank you very much. Reb will be here if you have questions. Like I said, I know it's a lot to comprehend right now. And if you get a question, we will pass it along. Thank you so much, Reb. I am going to go back to sharing my screen and back to our presentation. And with that, I'm very proud to announce she's our first time here for our Navigator Focus series, Dr. Erica Valdovinos. She's going to talk about Quality Incentive Program. And Dr. Erica Valdovinos is from Adventist Health Mendocino Coast. She's also our implementation leader here at California Bridge, and she is an attending emergency medicine physician. And she has her MD from UCSF and was trained at Highland Hospital. So we know you're a pro, Dr. Erica. And I'm going to give it to you. Hand it off.
Thank you so much. So I work in Ukiah, and we were very much looking forward to trying to do some community health worker billing as well. And our path was a little bit different. So I'm happy to share with you all. So if we can go to the next slide. Overall, what we're thinking about is how do we get reimbursed for this work, right? How can we get reimbursed so that we can convince our hospital administrators that it's really important to keep these substance use navigators on board, not just because it's good for patients, but because it aligns with financial goals as well. And when we talk about reimbursement, if you can go to the next slide, what we're talking about is really payers. So payers is another word for typically insurance. So those are the ones who are paying us for our work. There's a few ways that we get paid. One is with a fee-for-service model. And what this means is that if you splint an ankle or provide some community health worker billing, you can submit that bill, and then the hospital or the physician gets paid for your work. But not every model works that way. So when we set out on this work, we learned a lot about insurance. And so bear with me. I know this is a little difficult and not what we do on a day-to-day basis, but it is important. So not every model works where you just submit a bill for what you do and then get paid. There's something called managed care plans. And this is a type of care plan that has the goal of reducing costs like an HMO. Many of our patients have Medi-Cal, and the type of Medi-Cal plan is going to be specific to the region. Some regions even have multiple Medi-Cal plans within that region. So you might have 4 patients with Medi-Cal, and they might all have a different Medi-Cal plan, which can make it confusing. So we learned that we have partnership health plan, and partnership health plan, like all Medi-Cal health plans, has a different agreement with each different health system. Partnership covers 14 counties, which is more than 600,000 people. And I am going to read for you guys these counties only because I'm saying some things that are specific to partnership. So you might want to know if you're in it. So Del Norte, Humboldt, Lake, Lassen, Marin, Mendocino, Modoc, Napa, Shasta, Siskiyou, Solano, Sonoma, Trinity, and Yolo counties. So we're in Mendocino County. And when you're setting up a meeting with your health plan, it's important to reflect on what does the health plan care about? So next slide. Health plans care about improving outcomes for their patients, right? And they want to do that through providing good, strong preventative health care. That looks like making sure patients have their diabetes managed well by a primary care doctor in the outpatient setting instead of ending up in the ICU from a complication of diabetes. They will continue to deliver necessary emergency and acute care services, but with an eye toward preventing hospitalizations and other sort of more costly outcomes. So if those are the goals of a health plan, that sounds like perfect for the work that we do, right? That is what we're all about, preventive health care and avoiding sort of unnecessary ER visits sometimes and hospitalizations. So when you set up a meeting with your health plan, you're looking for the person who is in charge of treating substance use disorder, which is typically within the realm of behavioral health. So for partnership, we met with the behavioral health team. And when we met with them to ask about how can we do community health worker billing. And we learned another new word, which is capitation. So next slide, capitation means that our health system has an agreement with partnership so that our health system gets a fixed amount of money per patient, per unit of time, like a year, paid in advance to the health system. So that means that overall, it doesn't really matter if all of the patients end up in the ICU, if none of them go to the ER, if somebody stubs their toe, they are all bringing in sort of the same amount of dollars to the health system paid by capitation. And this is a direction that a lot of healthcare is kind of moving, and many Medi-Cal plans are moving in this direction. And it's going to look different. Sometimes it's capitated for the whole population, sometimes just inpatient, sometimes just outpatient. You don't need to know all those details, but what you need to know is that sometimes the fee-for-service billing, like community health worker billing, won't be feasible if something like this is set up. And that's what we learned, that because our health plan had this agreement with our healthcare system, community health worker billing wasn't going to work for us because we weren't billing for each service individually. And at first we felt pretty defeated because my son team and I felt like, oh no, our whole plan was we were going to do community health worker billing, and now we can't do community health worker billing. So what are we going to do? But then we thought about it a little more, and this capitation agreement, it really emphasizes quality care, access to preventative care, and kind of improving health outcomes for the whole community, right? And so we use that to inform our strategy. So next slide. So we kind of doubled down on our strategy, thinking about what do health plans care about and using that information to make an argument to hospital administrators. That looks like the return on investment calculator that shows that, hey, when our substance use navigator has contact with a patient, there's fewer ER visits and fewer hospitalizations. And then it led us to explore different departments within the hospital. So when a health system has this type of kind of quality over quantity of care agreement with the health plan, they typically have a department that is focused on improving outcomes for patients and also reducing those more costly outcomes. So that might be called population health. And when we met with our lead for population health, he actually said, I'm going to stop you right there because I can tell it is obvious that your program saves money. So you don't have to tell me anymore. We just need to find a way to sustain this. It makes sense. I know, for example, in Lake County, they have a department in which their son is housed that is completely focused on social determinants of health and addressing things that keep people out of the hospital before they even get near the hospital front door, like housing and mobile showers. And so it was sort of like a natural fit, even though the substance use navigator is housed within the ER. So it can kind of direct you to other departments within the hospital. And that was very successful for us. And we were able to secure funding within our hospital for all of our navigators, irrespective of grant funding, and even in absence of community health worker billing. And there was one more little bonus. You can go ahead to that next one. That's sort of like a great cherry on top for this, which is the hospital quality improvement plan. So another another sort of set of words that sounds a little bit boring, but Partnership Health Plan has a financial incentive package that incentivizes hospitals through dollars to meet certain patient safety metrics. And for fiscal year 2023 to 2024, they included having proof of a full-time dedicated substance use navigator as 10 points. And it's out of like 105, 115 points. So it's a substantial contribution to their overall financial bonus that they can get at the end of the year. And interestingly, after asking around for a few months, I still haven't been able to figure out exactly how much money this means that our hospital is going to get, but I've been told it's probably a lot. And I'm okay with that answer. It's probably a lot, right? Because that just helps me when I'm making the argument for how valuable our navigators are to our health system. It's not necessarily about proving for us, like dollar for dollar, that they're kind of earning the system as much as it costs to sustain the program, but more that like, look, these navigators are not only good for patient outcomes, but aligns really well with the goals of the healthcare system and the goals of our health plan.
What, Erica, that was a lot. I know, learning about capitation, all of this stuff, so thank you for breaking that down. We have some chat going on, and I don't see a ton of questions, more like statements. I know, Serena, do you want to come on? There was a question. How many encounters is the navigator doing to generate the 5,000K? That was per Reb's. Reb's webinar, so we will get that information to you. And then there's some talk about the health plans. And if you're not sure about health plans, somebody put in the chat that there's a directory right in the chat there. Thanks, Shannon, about the CalAIM document, as well as the Hospital Quality Improvement Program specifications. So does anyone have a PowerPoint explaining capitation in detail on Bridge? Right now, we will record this one. This is a great simplified explanation. And so this is what we have, and you will get it post-event email. She did a great job on breaking this down. As case managers in our hospital, I know they go to in-depth trainings about this, and you did an awesome job, Erica. I just want to say that. Does anybody else have any questions for Erica? Because, the CHW billing may not work for everybody. It depends the location that you're at. So again, we're giving you multiple strategies to enrich what you're doing already. Talk to your ED directors, talk to your leadership, because they may not know these things. So schedule a meeting with them and share the video when we send it to you. Is Medi-Cal supposed to change at Kaiser that allows more service? Gerald, we would have to look into that. We do not know about Kaiser at this time, so we will get back to you on that question. Serena, go ahead. You have your hand raised.
Yeah, I was just going to share a couple of other comments related to health plans. So what I want everyone to understand is Erica talked about the fact that her health plan partnership has this quality incentive program that incentivizes the hospital, gives them 10 points. Well, what's on the screen right now gives them 10 points if they have a navigator. So that is specific to partnership. But every managed care plan has some kind of a quality incentive program for the hospitals, for some of the hospitals that they work with. So it is worth everybody looking, asking, what is the quality incentive program that my hospital is part of? And is there a quality incentive related to substance use disorder? And I know that the fact that partnership provided this 10 points for a navigator, that's not an accident. Like, they did that because the hospitals that are in the partnership network, and we at California Bridge have been talking with the people at partnership for a long time about, hey, this program exists. It's a benefit to your members. you should want this program. You should incentivize people to have this program. So that is just because your health plan doesn't have that in their quality improvement program now doesn't mean that they might not. And that goes back to the, make friends. You got to tell them what you do. Your folks from the hospital, you got to go to your hospital folks, and they got to go up. The leadership has to go, the people who talk with the plan, and say, this is a really important program. And the thing that I also want to share is that the plans are actually incentivized to care about this, because in 2022, the state adopted a new set of measures for health plans, and the health plans get judged on these measures. So they want to do well. And one of the measures is the follow-up for patients who are seen in the emergency department for substance use disorder. What percentage of those patients can they confirm get linked to follow-up care? That is a measure that health plans have to report to the state. And obviously that is exactly what our navigators do. So there's a built-in incentive structure here for the health plans to care about your work and to pass that incentive down to hospitals to care about the work. So we've got a lot of things going for us, but it does take the work that Reb did, the work that Erica did. Like, it doesn't just happen without people actually going in, starting the conversations, telling people about the work, and sort of working through all these people and systems to actually get this to happen. So that is the comment that and then I just to address the question about Kaiser. Yeah, so starting January 1st, the state they rebid all of the Medi-Cal contracts. So most of you, it's probably not going to change for you. Your health plan, your Medi-Cal health plan will probably still be the same. But in some counties, they got rid of certain plans and they added new plans. And so in some cases, Kaiser is going to be a Medi-Cal health plan where it wasn't before. So some of you are going to see some of your plans changing and your patients having to shift from one plan to another.
Okay, great. Thank you so much, Serena, for some insight. And thank you, Reb and Erica. That was great successes and examples of sustainability. So we're going to move on. If you have no more questions, and the questions about CHW, so that's coming. Be patient, you guys. But we did want to just remind people of best practices for sustainability. Again, we want to make sure that you know what is working, right? That is the most important. So among hospitals that sustain their navigator, we wanted to know what was the most useful strategies. And so these were the top 3, 95% meeting with hospital leaders and sharing patient stories. Again, this is very important. You guys have to be visible. And the second thing was asking about other staff to talk about the program, right? We know you have cheerleaders and champions that are not the official clinical champion, but there are people that are champions. Your charge nurse, for instance, may be somebody. And then the third thing is sharing Bridge MAT program data. That has been very useful. We also wanted to mention our Navigator Advisory Council previewed the survey, and they wanted to include their strategies for success and was promoting their program, giving presentations in all departments and anybody who wants to listen to them talk. They sent emails, they sent data, they sent their ROI calculator to anybody that would listen. So we know that this is a successful, and it's going to be successful of strategies. So you might take one, you might take all, but we definitely want you to try everything. I skipped over. We did want to take a poll before we go on. And Aiden's putting it up right now. Are you planning to apply for the CHW certification? We're going to give you a moment to answer this. It's yes, no, undecided, or no, I'm a licensed social worker registered nurse. So just let us know. We'll take a minute. And this is in preparation for more to come. Okay, we're just going to wait. We just want to know how many of you are applying. And it's okay if you're undecided. That's why we put one on there too. And this is anonymous, so, no names are attached. We're not holding it to, holding this to be true. But just what are the plans? Specifically, if you do know, that's great. It just gives us some information. Okay, did we close the poll yet? Let's see. So 72%. Okay, that's a huge amount. All right. And no, 8%. And no, because they're a social worker registered nurse, which they already can bill for Medi-Cal. And then 17% is undecided. Okay, so we'll give you some information in just a second. Let's go back. So again, I know we keep saying the same things over, but this is what works. Bill for services, the community work, health worker benefit, the procedure code for your physician, and then generate support. Again, we cannot talk about this more. Increase your visibility, share stories. So there's nothing new here. As Serena said before, it's the same thing that we keep saying. Increase your impact, your patient encounters. Make sure you're collecting your data. Utilize electronic consults. That's a success for some of our successful sites. Making sure that is brought to your IT, so that way it's easier for you. And then we have, what is the expert code? Okay, I'm not sure there's a code. That's a different webinar. We're not doing expert today, but I can, the other slide was the G code, and that's for the patient provider fee. If you need more information, just shoot me an email and we will give that more to you. And then make rounds with your staff. Okay, check in with the charge nurse, attend shift huddles if you guys aren't doing that, or staff meetings, and reach out to community resources. So now I have Serena, go ahead and you have a question?
I wanted to just ask, I wanted to circle back, since we're talking about community health workers, I wanted to circle back to Reb and ask her if she could talk about the Navigator encounters. And it sounds like, just to confirm, that you're generating $5,000 a month from the CHW billing. And I wanted to know if you know roughly how many encounters that is per day or per week for the Navigator to generate that amount of money. And if you did anything specific to increase that number of encounters, or to think about what kind of encounters the Navigator billed for in order to be able to generate the revenue.
Yeah, so I went back and made sure I had the math right, that it is $5,000 a month-ish, and it's about 70 visits for the month, plus or minus. So for what that's worth.
And
we did put in there.
How many navigators do you have, Reb? Two? Okay.
Two.
Thank you.
Yeah, so we're 7 days a week. They have crossover certain days, and a few days of the week it's only one of them is on. So yeah, that's where that came from.
Great.
And then as far as the note and the referral, so much of it is just, they scan the board, they have a presence in the department, all the stuff you've already mentioned, to make sure that they're getting those referrals.
Okay, thank you. Thank you for the information. So really important to get your patient encounters for the reimbursement. Okay. So now we're going to switch gears. A lot of you had questions in the chat about the CHW benefit. Of course, we all know that it's a Medi-Cal benefit, and it started last July 2022. And what we want to remind people is that I prepared this whole slide, and Monday there was a webinar, and they let us know that the whole certification process is on pause because they received over 300 inquiries, and they need to do restructuring of the infrastructure for the program, and just making sure that they do it right the first time versus that just going ahead with the way that it was set up. So they really want to increase the infrastructure, improve the benefit. So with that being on the Monday afternoon and today's presentation, we're still going to go forward with telling you how to gain your CHW certification, because your hospital can still bill. You have 18 months to get certified, and now probably maybe longer, depending on when HCAI opens their portal. So the Department of Healthcare Access and Information will be the governing body to provide the actual certification. What you need is, because you have experience, you need to know the details, and that's what we're here for to do today. So let's go on. My computer froze. There we go. So what is the CHW? Well, the guidelines state that there are 2 pathways to certification: training with no experience. And we're not going to talk about that today. We're only going to talk about the actual experience pathway that our CA Bridge navigators will qualify as long as you have 2,000 hours. Now, this does not have to be at one site. So if you were doing a role of pure navigator, substance use, counseling, it has to have the whole year of experience. So you would still qualify. Just be clear. The requirements are a self-attestation of lived experience, your own or of a family member, documented hours of 2,000. The key point to this is your supervisor can sign you off. All they have to sign you off and verify is 500 hours. So if you work someplace else and you bring those hours, that's fine. If you have not been, the 1 year at one facility, totally fine. Previous experience is accepted, but your current supervisor only needs to sign you off for 500 hours. Okay, and then you have to have this thing called verification of your core competencies. So anybody that supervises you or an organization official can attest that you have the core competencies. And because we, CA Bridge, provided the Sun Training 101 and Navigator toolkit, you have attained these competencies. So again, if you have your certificates, if you do that, we encourage everybody to go on CA Bridge Academy, watch the video, the whole training 10. You can print out your certificate of completion or CEU. And so that would qualify you to have the core competencies covered, because you've been coming and listening to us. So, it wasn't worth just air to the wind. You guys get credit. So we're really excited to promote this. So the CHW experiment will be available. So they're extending, probably will extend it because everything is on pause. Remember, the experience pathway, you are eligible for certification until June of 2029. So that was the original. Not sure after this pause. So we have plenty of time to become certified. So it's not imperative. Again, we know it's on pause, but as long as you are ready to go with all the information, you know that you are eligible and required for when the portal by HCAI is ready. So what are those core competencies? Communication skills, interpersonal and relationship building, service coordination and navigation. You guys got that one down. Capacity building, advocacy, education and facilitation, individual and community assessments, outreach, professional skills and conduct, evaluation and research skills, and have a strong knowledge base, right? So definitely all of our Sun Training 101 series covers all of these competencies. So we're here to help you. Again, your supervisor is the one that has to sign you off, but we've developed a CHW certification guide. It's a step-by-step guide that has everything listed, and you will receive this template on the event, post-event email. So there's a complete checklist so you could be ready. And there's attestation, a self-attestation signature, as well as work hours. It's all in one spot. So this is what it looks like. It gives you the background. It also tells you all of the requirements in writing, and it has this wonderful checklist. And I think Chaya put it in the chat right now for you to review. And it's a checklist. It says for you to review the requirements, complete the self-attestation, complete the verification of hours, and most important, you need to have the CA Bridge training courses completed. And again, if you saved your certificate of completion or CEUs from previous trainings, just add that. And then the ones that you haven't done, go on the CA Bridge Academy. And again, you can print it out. And if you need a certificate and you watched it, you can do that as well. Just let us know at mentors@cabridge.org and we will guide you through that process. We want you to present all the materials, this whole checklist form for your supervisor to sign off. And then whenever the portal from HCII is available, we will keep you updated and you can go directly. So here's what the self-attestation looks like. You just provide that you have provided services with populations that align with your lived experience. It's defined below: personal knowledge of a specific health condition or circumstance, or part of someone's self-identity, such as a member of race, community, or the LGBTQ and community. So again, the self-attestation, you just need to sign. You need to verify the hours. This is the part that you write where you've done your hours and that you completed the core competencies. And these are the core competencies. And this is a crosswalk. It tells you what core competency and what training that you either read in the toolkit or that you watched the videos. So it's all here on this document. And we provided one place for you to do it all. So I'm going to stop here for questions. I'm kind of right now, I would have to go back, and I know there's somebody who has their hand raised. So Gerald, do you want to come off and go ahead?
Hi, Sherrie.
Hello.
Sherrie. My question is, if I attain the 2,000 hours at my current site, can my supervisor sign off for the whole 2,000 instead of just 500?
The requirement for experienced is only 500. I mean, they can sign you off for more than that, but the requirement that HCAI has made for the experience is 500. So yes, they can.
So what is the 2,000 hours that's needed? And does that need to be verified, the 2,000 hours?
Only the 500. So, you know, I know that that's a little confusing, but what it means is like your experience is the 2,000 hours, but the supervisor only needs to sign off 500. That's it. If you have more than that, you know, that's not going to be a problem for them to sign you on. What the reason why they said the 500 is if you have not been at your facility for the whole time, because some of our navigators have moved around. And so you just have to have the full year of experience.
Okay, so my supervisor could just sign off for the 500 and I don't have to confirm the rest of the hours.
Right. We provided on our checklist a spot for you to list it all. Just so your knowledge, because I'm not sure what the portal, you know, now that they're put on hold and there might be changes. So I recommend you still write down and be ready, because it might change a little and we want to make sure that you have more than enough information than not enough.
All right. Thank you.
You're welcome. Serena?
So Sherrie, would it be correct to say that the 500 hours you have to get sign off, but the rest of it is like self-attestation?
Yes.
Okay.
Absolutely.
So they want you to have it, but you don't have to actually have it signed off. You just might need to tell them. And the other thing I want to be clear on, but I want to confirm that this is correct, is that we are, of course, very, we believe in our training. And we want to promote our training. We want everybody to do our California Bridge Academy training. However, the supervisor, if you've been working for years as a navigator and the supervisor is willing to sign off on your competencies, they can do that without proof that you attended any particular formal training, whether it's ours or anybody else's. Is that correct? They're just basically saying, I attest that this person has these competencies.
Correct. And that's written on there. We're just made it easier for them to look
Right.
and show what core competency and what send training. If they've had previous experience, the navigator would have to tell that to their supervisor. This is just an easy
Additional confirmation that you really have those skills. Okay.
Absolutely.
Great.
Okay. Gerald, do you have your hand up again? Or is that from previous?
Sorry, old hand.
Okay. I didn't want to look over you. So we have a question. I'm trying to go back, so I don't know if I went back far enough. What the benefit is of being a CHW? Is it for billing purposes? Yes. If your organization is looking into CHW billing, it does. It would help them when the time came for the 18 months. We said when you can bill for billing with the CHW billing benefit, your CHW has to be certified within 18 months. So that's why that would benefit you, is they can bill now because you are doing the work, you have the experience, and so they're giving time for you to get the certification, and we're just waiting on HCAI to open that portal, which is now on hold. We understand, but we are making sure that we are abreast of all of the most current information, and we will pass that on to you, which reminds me, make sure we have your current email and that you're on Slack. Those are the two communications that we will be announcing any changes to this update. Those are our best form of communication. So please make sure that you're getting our emails and that you're on Slack.
Sherrie, can I just add on about the benefit?
Yes.
So yes, it is for billing, but even if your institution can't bill right now, and probably it can't, because literally Reb's hospital Chomp is the only one we know of so far that's actively billing. Even if you can't bill right this minute, your institution may be able to bill in the future, but also this is really a broader direction that the state is going. The state has, and California is actually behind. A lot of other states have had some kind of way that peers or community health workers could be reimbursed. So California has finally is in the process of developing this more formal recognition of a community health worker. So if this is something that you want to do as a career, it's great to get certified, both for the billing purpose now, but also for your own career development and for employment in other settings. This is going to be a much more officially recognized role in California than it ever has been before. So again, just want to really encourage people to get certified when you can.
Great point, Serena. I couldn't said it better, you guys. Professional development, for many of you that have expressed that you don't have any certifications, you don't have anything, this is a great way to promote your self-promotion and professional development. So thank you so much for bringing that up, Serena. Do we need all certificates for all trainees? That would be up to your supervisor. We recommend it. We want you to be ready and one stop. Here you go. Here's all my trainings. Here's all my certificates. It makes it really easy for your supervisor to sign you off. Just from personal experience and being in management at a hospital, when you have everything in your whole folder with all your certificates and all your papers, it makes it really easy for that director, supervisor, manager to sign it off and say, well, I need this, or I'm going to look at it. Well, it's all here. So making that really easy for them really benefits both of you. And you have everything there that you need. So that way, when you do go on to the portal, I'm not sure if they're going to make you upload those. That's something that we're waiting on for the portal to open. So just have everything ready. That's the best thing that I can advice and suggestions we can give to you. All right. Any other questions, you guys? Is the self-attestation going to be provided on the HCI portal? Again, you'll probably have to upload. I'm not sure that they're going to have you sign on the portal. So you'll have all of your paperwork in one spot, and you could submit the CA Bridge step-by-step guide. So that would be a paper that you could probably upload, and you don't need to download something, but again, since it's on pause, we don't have more information. And as soon as that comes out, we will let you know. But again, our step-by-step guide has everything you need to apply. Once we complete the checklist and all required steps, how and when we know that, we will let you know. Right now, it is on hold and pause. We do not know how long. The portal was supposed to be up in January 2024, but obviously with this pause, we are not sure. Okay, I have something. I'm no longer a navigator, but worked as a SEM for 3 years. Can I apply for CHW certificate? Yes, as long as you have the experience and you meet the qualifications, absolutely. Okay. When do we apply? Okay, does everybody understand that it is on pause? So just we do not have a date when you can apply. As soon as we know that, we will definitely, we will let you know. And like I said, make sure we have your email, that you're getting our emails, that you're on Slack, because we will spread the word as soon as we hear something. But again, it may be a few months, but get ready, get all of your paperwork ready. Can we retro bill? You know what? We will get back to you, Karen, about retro billing. I'm not sure, and I'm not going to pretend to know that, so we will let you know. Do we just use all our sun working hours towards the 500? Can I use my time as a ERRN towards these hours as well? Terry, from my information and from what I understand, RNs do not need a CHW certification because you can bill for Medi-Cal. So this is something that you would have to talk with your charge masters as far as we're in a different role. I'm an RN as well. And so we are unable to bill for CHW certification because you're already billing for the hospital, and the ED is something different. So you already have the RN title. So if you need more information, please email me or give me a call, definitely. So if we're not using the CHW billing yes, we've already talked about that. Yes, we want you to have it, especially if you have no certifications. This is great professional development. I'm an MPH, so that is why I was wondering if the benefit, who's benefiting now? I understand it is benefiting the hospital. Yes, it's reimbursement for the hospital, so that they can get paid and they can sustain your position as a navigator. Okay. Anything else? Can they sign off now? Yes, they can sign you off. Totally. If you have all of your stuff ready, be ready for whenever anything comes, but you'll have everything already all together. Who would I speak to the hospital, start the process of CH billing assessments? Per Reb, you may want to talk to the ED director, and they understand more about the billing if you could do that. So definitely. Once certified CHW, will this be something that we have to renew periodically? Yes, you will have to renew, and you'll have to have approximately 6 hours of education upon renewal. So again, I'm not going to quote anything now because they're revising it, and but yes, there will be a renewal component to that. Is there a way to obtain certificates that we completed that we no longer have? Yes, you can go on the CA Bridge Academy and you can download. So just let us know if you need more information and we can help you with that. Okay, so for this new grant, is to say we have to be certified by April? No. You do not have to be certified by April. The question is a deliverable, and that will be made available probably in the beginning next year. But what it is that you're assessing, that you're looking into it. That is the assessment part. So no, you do not have to be certified. Okay, Kathy has her hand raised. Kathy, did you have a question, Kathy?
Yes, thank you so much, Sherrie. This is Kathy Krebs-Dean. I'm with Dignity Health / Common Spirit Health. And I want everybody who's a son on this call to let me know of their plans to take the California Bridge CHW training. This is a request. It's actually a preference of our leadership who has at the moment agreed to sustain the sun positions. And that's contingent on us continuing to do things like pursuing the CHW certification so we have the potential for billing. And then secondly, just, also continuing to do our work around reporting on deliverables, the impact and that sort of thing. So I just wanted to mention that that's something that I'm hoping that everyone will kind of keep me up to date, and I can also connect those who are unable to take the California Bridge training to potential other resources to support their pathway to certification training. I wanted to mention that. And then I have another question, and it's really about that billing piece. I'm really so intrigued with what Reb has been able to do with CHOMP. And the question I have has to do with, I'm curious about the CPT codes that your health system is billing for, whether it's just basically that 98960 CHW code for the Medi-Cal billing, or, and I realize that's probably a pretty narrow question, so I would be willing to take that offline if you would be willing to share that with me, Reb.
And if she's not here, Kathy, I will definitely relay that to her, and I will give you a warm handoff, definitely.
Yeah, thank you so much, because some of those structural barriers that we were talking about earlier with getting the billing system set up, that's something that I'm trying to crack the code on within Common Spirit Health, along with a couple of other internal leaders there. And one of the big questions is we're trying to make some projections about, what is the potential revenue that could be captured through some of this activity. So yeah, please reach out and connect me offline. That would be great.
Absolutely. Thank you for attending. Definitely. There's more to come. We'll have more chats about this. And I thank you. We are over 3 minutes time. I am so sorry, you guys. And if you have any questions, there's CA Bridge Academy. You can use the QR code. I'll leave it on there for a minute. Get signed up. If you need help, please reach out to us on Slack or through our emails, mentors@cabridge.org. Again, we have our whole mentor team. If you have more questions, please reach out to them or myself. And thank you for joining us. We hope you found this very informative. I did. I know I loved Reb and Erica's presentation. So if you need any help with sustainability, we have Serena. Thank you again, Serena, for coming, and Erica and Reb. This was amazing. So much great information. I know sometimes it's overwhelming. So any questions, please give them to us. And thank you again for our panelists. This was great. And reach out to us if you need help. Thank you.